Hello everyone, my name is Ryan Heiden, and this is my presentation for Week 8 titled The Future of Health Policy. Throughout this class, I've analyzed several healthcare policies related to maternal health here in Texas, and after evaluating and doing the projects that we have in the past, um, all three proposed options that I've done, I've decided to support the Texas Postpartum Medicaid Expansion Policy, which expands postpartum coverage from 60 days to 12 months after childbirth. In this presentation, I'll discuss why I choose this policy, why it offers the greatest benefit to healthcare clinicians across the state, and what makes it a top priority for advocacy and health policy development in Texas. The policy overview. This policy aims to extend Medicaid coverage for mothers in Texas, which is currently 60 days to a full year after birth. Currently, many women lose access to healthcare right when they need it the most, especially in rural and underserved areas. This coverage gap often leads to preventable complications, untreated chronic conditions, postpartum depression, and even maternal deaths, which is by largely unnecessary. By expanding coverage to 12 months, the policy provides mothers with the time and continuity needed for both physical and mental recovery. It specifically focuses on three key areas: reducing maternal mortality, improving chronic disease management, and supporting mental health and postpartum care. As someone who has worked in both 911 EMS as lieutenant fire department and as ops director in a healthcare company, I've seen how critical follow-up care can be for patients. When care stops too soon, small issues can quickly become emergencies. Extending Medicaid postpartum coverage ensures new mothers have the support and access they need to recover safely. Why I chose this policy? Well, I chose this policy because I've seen firsthand how coverage gaps impact mothers and families in Texas. When I worked as a healthcare director in operations, I helped oversee postpartum programs and collaborated closely with the DPH or Department of Public Health. Many mothers lost Medicaid coverage before they had time to stabilize their health or manage chronic conditions. On the fire department, as lieutenant, I also responded to 911 calls where new mothers faced emergencies that could have been avoided with consistent follow-up care. These experiences showed me that expanding postpartum Medicaid coverage is not only good policy, but more responsibility to protect the lives of mothers and families across Texas. This is why I believe the postpartum Medicaid expansion policy represents one of the most meaningful steps our state can take to reduce preventable maternal deaths, improve continuity of care, and support long-term recovery for new mothers. This leads into my next point, which focuses on how this policy benefits healthcare clinicians and how it strengthens the overall healthcare system. Anticipated outcomes. If this policy is implemented in Texas, it is projected to significantly reduce preventable maternal deaths. According to the Texas Maternal Mortality and Morbidity Review Committees of 2024 biennial report, that nearly 90% of maternal deaths in the state are preventable. That's crazy. Extending postpartum Medicaid coverage to 12 months would help address this by allowing early detection and treatment of conditions such as hypertension, infections, and postpartum depression before they become life-threatening. Research by Benskin and colleagues in 2024 also supports this approach, showing that consistent coverage after childbirth leads to lower readmission rates, better chronic disease management, and stronger maternal recovery. For hospitals and healthcare systems, continuous coverage means fewer emergency room visits, lower uncompensated care, and smoother coordination between parental, delivery, and postpartum care teams. Most importantly, this policy will help Texas families. Extended coverage promotes healthier mothers, stronger infants, and greater family stability, while at the same time it's easing the financial and emotional stress that often follows a complicated birth. Together, the findings from both the Texas Maternal Mortality Committee and Benskin's research highlight why this policy could be a turning point for maternal health in our state. Why it's the best choice for clinicians. Well, this policy supports healthcare clinicians by removing the financial and administrative barriers that often disrupt patient care. When I served as a healthcare ops director, I saw firsthand how frustrating it was for physicians when patients lost their Medicaid coverage shortly after delivery. It interrupted treatment plans and forced providers to focus on crisis management instead of prevention. Expanding postpartum Medicaid coverage allows clinicians to continue follow-up visits, monitor chronic conditions, and adjust medications safely over time. Research by Zhang and Wu in 2021 supports this approach, showing that consistent access to care encourages evidence-based preventative practices and reduces long-term complications for mothers. This policy also reduces the burden of uncompensated hospital care, allowing healthcare organizations to focus more resources on quality improvement. For nurses, case managers, and social workers, it strengthens patients' relationships and builds trust. Something I witnessed personally with our teams when they were able to maintain ongoing communication with mothers throughout the postpartum year. Ultimately, by giving clinicians the tools and time to provide consistent, coordinated care, this policy improves both professional satisfaction as well as patient outcomes. The selling point for advocacy. Well, the main selling point for advocacy is simple. This policy saves lives and it saves money. According to the data from Texas Maternal Mortality and Morbidity Review Committee of 2024 report, most maternal deaths in our state are preventable. Expanding postpartum Medicaid coverage helps fill that gap by ensuring continuous access to care for mothers when they need it the most. From a moral standpoint, this policy protects both mothers and children. It supports the family unit by preventing avoidable medical emergencies and providing the continuity of care which is necessary for recovery and parenting stability. Now, from a fiscal standpoint, every dollar spent on preventative postpartum care saves multiple dollars in uncompensated care costs. Studies like those by Benskin and colleagues in 2024 have shown that expanded Medicaid coverage will not only improve maternal health, but reduces long-term strain on healthcare systems. Finally, from a political standpoint, this policy has a strong bipartisan appeal. It focuses on families, not politics, and it aligns with both public health priorities and fiscal responsibility. Advocacy groups, professional organizations, and hospital associations in Texas can unite behind this initiative because it strengthens communities while improving efficiency and accountability across the healthcare system. Ethical alignment. This policy aligns with four core principles of healthcare ethics: autonomy, beneficence, non-malfeasance, and justice. Autonomy is supported by empowering women to make informed healthcare decisions throughout the postpartum year. Continuous Medicaid coverage gives mothers the ability to seek help for both physical and mental health needs without fear of losing coverage or facing financial hardship. Beneficence focuses on doing good, and this policy promotes the positive and equitable outcomes by ensuring that women receive timely and appropriate postpartum care. As noted by the Texas Maternal Mortality and Morbidity Review Committee, many adverse events happen because care stops too soon. Extending Medicaid coverage directly addresses the gap. Non-malfeasance, or preventing harm, is achieved by avoiding dangerous interruptions in care. Losing insurance 60 days after delivery can lead to untreated depression, hypertension, infections, or conditions that can quickly become life-threatening. Finally, justice ensures fairness and access, particularly for low-income and rural mothers in Texas. Rural hospitals are often the only point of care for miles, and ensuring extended coverage helps reduce disparity in these areas. From my own experience working in healthcare operations, justice resonates the most. Every mother, regardless of the income or zip code, deserves the same opportunity for recovery and support for their child. Real world experience. Now, This slide ties together both my administrative and emergency response background, showing how the lack of consistent coverage can have tragic preventable outcomes. My experience has given me firsthand look at the human impact behind policy data. When I worked with the DPH or Department of Public Health, I oversaw postpartum care in teams and compliance reporting. We noticed a clear pattern. Uh, Many women lost Medicaid coverage before they were medically stable, especially those dealing with complications like hypertension or postpartum depression. Flip side, when I went to 911 as a lieutenant in the fire department, I also saw several other issues play out on the front lines. I would respond to 911 calls where new mothers were in crisis because they didn't have access to follow-up care or medications. For instance, asthma and albuterol is just a simple one that comes to mind, among many, many others. In several of those cases, coverage had expired just weeks before the emergency occurred. These experiences made it clear that the health policy isn't just about numbers, it's about real families trying to save system gaps. Seeing that this reality firsthand motivated me to focus my graduate studies on improving maternal health access through sustainable policy, solutions like postpartum Medicaid expansion. Also, living here in Texas and being a new father. Implementation challenges. Now, while challenges do exist, they can be effectively addressed through strategic leadership and data-driven advocacy. The first challenge is the state budget constraints. Texas has historically been cautious about expanding Medicaid due to concerns about long-term spending. However, the data from the Kaiser Family Foundation 2023 shows that expanding coverage ultimately will save the state money by reducing uncompensated care and emergency room visits. Emphasizing these long-term cost savings is a critical part of the advocacy message. Second challenge is the political resistance. Medicaid expansion has often been viewed as a partisan issue, but this specific postpartum extension has been bipartisan potentially. It focuses on mothers, infants, and family stability and value support across the political spectrum as a whole. Building coalitions with both parties, along with community organizations and healthcare providers, can help bridge the ideological divide. Now, finally, administrative delays can slow coverage renewals, leaving mothers in limbo. Streamlining the eligibility system and coordinating data across agencies can help ensure seamless transitions for postpartum women. Overall, overcoming these barriers requires showing lawmakers and stakeholders that the return on investment will go beyond money, it saves lives, strengthens families, and makes Texas healthcare more sustainable. Advocacy and collaboration. To advance this policy, collaboration among nurses, healthcare administrations, public health agencies, and legislators is essential. Policy change does not happen in isolation. It requires coordination, shared goals, and strong communication between partners. According to Kirsch et al. 2024, successful maternal initiatives depend on advocacy coalitions that combine professional expertise with the community and experiences. In Texas, partnerships with hospitals, Department of Public Health, DPH, are especially valuable because they help close data gaps and present an unfilled message to lawmakers. In practice, advocacy begins with three key steps. First, gather both data and personal stories to show how postpartum coverage loss affects real families. Go out there and see from real people who've lost coverage how they've been effective. Second, present the economic benefits clearly to demonstrate that the preventative care is both cost-effective and life-saving. And finally, engage local coalitions such as nursing organizations, maternal advocacy groups, and community leaders to build and support and reach legislators more effectively. From my own leadership experience, the best results come when healthcare professionals and communities work together. When data, stories, and collaborations align, progress becomes both realistic and sustainable. Long-term impact. In the long term, extending postpartum Medicaid coverage strengthens more than just individual care. It reinforces the entire healthcare infrastructure across Texas by ensuring that new mothers maintain consistent access to medical, mental health, and social support services for a full year. We create a stronger foundation for both maternal and infant health. The first major outcome is improved maternal and infant survival. When mothers have continued access to care, chronic conditions like hypertension, diabetes, infections, and postpartum depression can be detected and managed early, significantly reducing the mortality risks. The second long-term effect is a strengthened healthcare infrastructure. Consistent follow-up care reduces emergency room demand and unplanned readmissions, allowing hospitals and clinics to allocate resources more effectively. This stability helps both rural and urban healthcare systems operate more efficiently. Finally, this policy promotes greater health equality across Texas. It helps close the gap for low-income and rural mothers who often face barriers to consistent care. By giving every mother the same opportunity for recovery and long-term wellness, this policy moves the state closer to true health equality. Overall, postpartum Medicaid extension is not a short-term fix. It's a permanent investment in the family health, workforce stability, and the sustainability of the Texas healthcare system as a whole. In conclusion, postpartum Medicaid expansion policy represents a realistic and transformative approach to maternal health care. It improves outcomes, supports clinicians, and ensures that women are not left without care during one of the most vulnerable periods of their lives. From both my healthcare leadership and first responder experience, I've seen the difference that across all the access to timeliness is important. Continuous care can make it literally save lives. This policy isn't just about expanding coverage, it's about expanding compassion, responsibility, and health equality. By prioritizing this policy, healthcare leaders and policymakers can make a lasting impact that strengthens families, communities, and healthcare system as a whole. Thank you for your time. Thank you for joining me in advocating for the future of maternal health. Here are my references for further reading. I'll now open up for any questions. Thank you.